Okay.
Really?
Start.
So there are 5 types mechanically, right? Cervical type 1, type 2.
Yeah.
So in cervical treatment, we need to give 2 types of headgear. Type 1, we always put, like, it's the center of resistance. Okay, we measure it from there. We first put downward bend. So this one is the one with the downward bend. We say it's type 1. Okay. This called crown to tip distal. Whenever we call tipping, we always correlate with crowns, right? And when we say torque, we correlate with the roots, right? So it calls tipping of the crown distal. Then we give, after the crown is tipped in the mouth, in second visit the patient comes, we use the outer bend to move up from the center of resistance, okay? And this will cause crown to upright. It helps in uprightening of root, okay? And correct the angulation. So now the whole tooth is moved bodily back. So first tipping, 2 stages. First tipping and then uprightening of the root. When the root get upright, there is 1 millimeter gap and there is molar distalization.
For deep bite.
Okay, for deep, no. Now we are seeing, okay, the best way to classify is headgear in deep bite, mesofacial phase and dolichofacial phase. So deep bite, which is brachyfacial phase, we use only cervical headgear. It corrects the facial type and it corrects the deep bite. So this will extrude and it can distalize, okay? Now,
the molars and
distalize them, okay? Then we come to the mesofacial facial type. Here we use a combi pull headgear. It is also called as, there are 3 names for this headgear. Combi pull headgear, oblique headgear, and one more, and horizontal pull. Horizontal pull, okay? So
type 3.
okay, type 3, we don't use type 3, mechanically third type, okay? So combi pull, oblique pull, horizontal pull headgear.
Yes.
Now here, what we do is, we put force at center of resistance, okay? Directly at. So it causes bodily movement of tooth only. No tipping, no uprightening. Only bodily movement distally, okay? Called molar distalization. Used in the mesofacial facial type. Now, how we can use bodily movement, that we giving 2 head strip, one occipital and the other one is a cervical. So occipital and cervical. And the force, the resultant can produce a bodily movement. Now the errors can come, tipping or anything, if your force level are different, like you giving 100 whatever the force you decide, from 250 to 500 or more than 500 for a thing. If either the force are different or the direction is different, right? Like the outer arm should be parallel, not up and down,
So
right?
if you want to change the occlusal plane,
Yeah, so you,
is one question here.
mhm.
We should use angulated outer arms or horizontal outer arms?
Long ferrets would be.
Long arms, but are they angulated or not? No. It's a question in here. If
There
you
is no
want to
angulation in
cancel
this
the
type of
occlusal
headgear.
plane,
Let her talk,
There
and
is-
then we come to the question.
Yeah, first we go with the concept,
Yes.
right?
Okay.
So the concept is that there is no angulation, right? It is only a bodily movement of the tooth. Angulations always come into the cervical headgear. Bending upward or bending downward, only type 1, type 2 headgear. There is no bending in combi pull headgear. The bend should be very much parallel to the occlusal plane. And there are 2 straps which going in 2 directions. It's used only in the mesiofacial phase. It's called molar distalization, right? And That
Also
is
in
all.
deep bite
Yeah.
cases, you can
So deep bite, you don't put this, you just use cervical. So there is a prescription as per the facial type. So there are 3 facial types, there are 3 different types of headgear. And what headgear do? Headgear do molar distalization, right? So cervical headgear do molar distalization by tipping and uprightening, and we do upward downward bends. Combi pull headgear, horizontal pull or oblique headgear do molar distalization bodily, okay? And there is no uprightening or tipping, right? Then there is a third is vertical pull, okay, or high pull headgear. High pull headgear, they have said they are not being used for molar distalization. Not being used. And in dolichofacial space, there is no indication for distalization, okay? Vertical pull headgear just only used for anchorage purpose, and it helps in correction of open bite patients by giving us vertical anchorage. Okay, so there is no indication for molar distalization. It's used only for this.
intruding.
Okay, intrusion. Now there is third concept is transverse dimension. Okay, now here we use expanded upper arch.
Yes.
Okay, cervical we use expanded out inner arm, expanded inner arm. And here we use with the TPA, we use TPA which is constricted, right? So it constricts because
To compensate.
to compensate the side effect of the vertical pull headgear, which is expansion of molar, buccal tipping. So use constricted lingual TPA.
Other possibility.
It
to
also
press,
calls-
to press
Inner arms.
the inner arm. Inner arm, make it
Yeah.
small. It will compensate
For the
Yeah,
thing.
TPA.
Yeah. So this is all headgear.
Here you should expand the
In
plan.
this
It's
also
here.
there are 2, right?
Hmm?
In this also there are 2.
No, there are only one
No,
type.
2.
So, guys,
four and
when
five
we
is
want
1,
to
2,
count,
3, 4.
It will
No,
intrude.
5 is there.
تعمل intrusion للموضوع.
I put
But
it
you
here,
have-
5 is there.
You
You have
change
short
the
arms or long
position
arms.
of the
Yeah,
molar.
5. Yeah,
المولر.
5.
هنا
Four.
بتعمل المولر.
Okay.
Short and long
you
arm.
have short and long arms here.
What is the
So what is the indication for short arm?
Short arm is like I'll tell you the molar will tip mesially. Molar will tip mesially.
And long arm?
will upright. This though.
also like this one? Two.
We are not doing any molar distalization with that.
Uprighting.
No,
It is
no.
there. It is there.
Let me open.